My name is Madeline, and I'm the overall scientific lead for SISAQOL-IMI, and I'm also currently taking the role of academic lead for the entire project.
And my name is Anders Ingelgard, and I work as PRO strategy lead at Boehringer Ingelheim, German company in pharmaceuticals, and I'm also co-chairing the work package 1, that's management and collaborations in SISAQOL. One thing is that I have been working in academia many years, but with the team that we have here in SISAQOL-IMI, I must say I'm very impressed by the knowledge and the latest information that we get on methodology. I also very much like the enthusiasm and that they are all very passionate about SISAQOL and are very focusing on the deliverables.
As opposed to Anders, I have never worked in industry before, so actually this SISAQOL-IMI allowed me to collaborate more with industry. And what I realized is that, at least in the PROs in oncology world, we are both sides are very committed in moving the PRO sphere forward and are very much interested in thinking about what is of value for patients. And I think this is very motivating to see within such a consortium like SISAQOL-IMI. And of course, you also discover differences, like how we implement PROs in trials. So when you do PROs in industry trials and EORTC does academic clinical trials, we have different stakeholders in terms of the research questions. But at the end of the day, hopefully the methodology that we use to respond to those questions, to respond to the needs of the stakeholders, will be aligned. So regardless of what is needed, at least we have evidence that is robust enough for the community. Yeah. From my side, when we started SISAQOL, I always think, SISAQOL analysis, PROs, who should be working on this? Statisticians, PRO methodologists, put them together in one room, write a paper. But then, what makes SISAQOL-IMI special is that this multi-stakeholder collaboration, and by uncovering the details of statistics, you realize that the assumptions or the decisions that the statisticians had to make about the analysis that they have to do have actually very large implications to the interpretation of the results. Like previously, when we deal with treatment discontinuation or patient's death, for example, in a PRO analysis, we just leave that all to the statisticians. But now with SISAQOL-IMI, we can actually talk to the clinicians and to the patient representatives to ask them, what does it mean to you? And be able to put that information into the statistical analysis so the results are very reflective, hopefully more reflective of what their needs are.
Yeah, I echo that. I think that was very well said. I also think that when you bring everyone to the table, you are able to develop guidances that are well informed. So I think the end result is something that's very well balanced. So that's something that can be accepted by the different stakeholders, of course. So I think we gain a lot of time. So we actually get the PROs to the patients, hopefully, faster. And that's really of importance to us. The other thing that I think is really important is actually the knowledge sharing. So I get to learn so much from the colleagues and from the other stakeholders, understanding their point of views, and also taking that into account when we do clinical trials in industry. So I have so far got several ideas to bring home and start piloting. So I think there are many good reasons for doing this type of stakeholder work together.